Americans are sold on supplements. By one estimate, U.S. consumers spent about $45 billion on dietary and nutritional supplements last year. Surveys show that more than half of all Americans are regular supplement users. We're convinced the natural ingredients in these non-prescription products, the vitamins, minerals, plant extracts, hormones, and amino acids, have powerful health effects that, among other things, can prevent diseases, make us feel better, and slow down the effects of aging. But can you trust what's in the bottle and the marketing claims used to sell this stuff? I'm Herb Weisbaum, the Consumer Man, a contributing editor at checkbook.org.
Welcome to Consumerpedia at checkbook.org. We're the nonprofit that helps consumers select services, avoid trouble, and save money. Because we don't accept any advertising or take money from any business we recommend, you can rely on checkbook.org to be completely independent and objective. Now, here's the host of Consumerpedia, America's consumer expert, the Consumer Man, Herb Weisbaum.
In this episode, the facts about nutritional supplements. Do they work? Are they safe? And have they been tested? We'll cut through all the hype and false hope often used to sell these products. We have three great guests to help us with that. Dr. John Swartzberg, head of the editorial board at the UC Berkeley Wellness Letter, Bonnie Patton with truthandadvertising.org, and Caitlin Dow at the Center for Science in the Public Interest. I'm going to start with Dr. Swartzberg. John is a great doctor and a good friend. He's been my go-to medical expert for nearly 25 years now.
Hi.
I want to make something clear from the start. There is no question that some supplements are worth taking, especially when prescribed by your doctor, right?
Absolutely. There are quite a few supplements that doctors will recommend for certain people.
And while you may be wasting money taking a daily vitamin supplement, that's not going to hurt you.
There's no evidence that a daily vitamin supplement will hurt you as long as your health is otherwise pretty good. That is, you have normal liver and kidney function.
But at the Wellness Letter, you've warned about the overuse of supplements and the lack of regulation. So what concerns you the most about this whole area of commerce that we spend so much money on?
There are quite a few things that concern me. The thing that concerns me the most is that people can be doing themselves harm, either because the supplements themselves can have toxicity for certain people, or because what they're buying and thinking is a pure supplement may be adulterated with a variety of other things that could be very harmful. So that's the thing I worry about most. But you know, Herb, there are so many things I worry about with supplements. They're completely unregulated, so that people really don't know what they're getting when they buy things over the counter. People have a lot of misconceptions about supplements. For example, people think that the FDA approves supplements, and they don't. They believe that if the label says that this supplement has a certain amount of a certain chemical, that they can trust that. You can't necessarily. They believe that the word natural on supplements means that the product is safe. That doesn't have anything to do with safety or efficacy. And speaking of efficacy, most people believe that supplements have been tested for both safety and efficacy, and they aren't. There's so many misconceptions out there. These products are unregulated. I think people, to a large extent, are taking their own health in their own hands, but they may be doing themselves harm with some supplements.
Yeah, you can buy these things at supermarkets, drugstores, of course, online without a prescription. So I think most people assume they've got to be safe, which, as you pointed out, you can't. And I want to spend just a little bit of time talking about the regulatory situation. As you noted, in 1994, Congress passed a law that says dietary supplements are foods, not drugs, which was designed deliberately to stop the FDA from regulating them. So these products can go on the market without any proof, as you said, that they're safe and effective, which is not the way prescription drugs work. Drug manufacturers have to prove that their prescription drugs work and are safe. That's not the case with supplements, right?
That's all absolutely correct, Herb. In terms of the regulation of supplements, the industry itself is an industry that makes billions and billions of dollars every year. And they hire lots of lobbyists to protect their industry. And the lobbyists have done a very good job making sure that supplements are not well regulated. It's really caveat emptor. That is, let the buyer beware. It's a really substantial problem in our society.
So basically, the only time the FDA gets involved is when people start getting sick from a nutritional supplement that wasn't properly tested or manufactured?
Right. But, how does the FDA find out that people are getting sick from taking a supplement? Supplement industries by law are supposed to report serious consequences from their products, but we know from experience that that's not happening on a regular basis. And there are multiple examples of this where people have been injured severely, and tragically some people have died, and sometimes these haven't even been reported by the supplement industry.
Now, drug makers have to report the possible side effects when they put a prescription drug on the market. Do supplement manufacturers have to warn you about the possible side effects of taking these things?
No. They don't have to at all. They're supposed to make certain statements about issues with their supplements, but they put it in very small print if they put it there at all. So you can't count on being given the upfront information. If you get a prescription drug, they give you a ton of information. Frankly, so much information, people just can't concentrate on all the information that they're given. And it's in pretty small print, too. The supplement industry doesn't have to do anything of the sort.
I know people who take supplements. They think it's a magic bullet. And as you and I have talked for years, there is no such thing as a magic bullet. But they think if they take a little bit of whatever and it's good, if they take a lot of it, it's going to be even better. And that's what really scares me with the way people use supplements in this country.
Yeah, for hundreds of years, there's been this famous dictum, that is, the dose makes the poison, and a little bit may be perfectly safe, but too much could be terribly harmful. And that goes for not just supplements, but for all medications, and frankly, it goes for just about everything in life. A little bit of water is necessary for our existence. Too much can be toxic. So supplements, you can't assume that if a little is good, a lot's going to be much better.
Another concern shared by consumer advocates, how supplements are sold, the cleverly worded claims and questionable testing. That's straight ahead. I'm Herb Weisbaum, and this is Consumerpedia, powered by checkbook.org.
If you like what you hear, we hope you'll consider being a Consumerpedia supporter by using the link at the bottom of the show notes to make a small contribution each month. This is Consumerpedia.
Here's a staggering statistic. There are more than 90,000 supplements on the market in the U.S. 90,000. Some claim to boost your immunity or improve your mood, help your memory, or improve cardiovascular health. What sort of marketing tricks do companies use to sell you this stuff? Here to discuss, Bonnie Patton, Executive Director and co-founder of the nonprofit consumer group Truth in Advertising, headquartered in Madison, Connecticut. You'll find them on the web at tina.org.
Hi, so glad to be here.
And Caitlin Dow, Senior Nutrition Scientist at the nonprofit Center for Science in the Public Interest. Caitlin writes for CSPI's flagship publication, Nutrition Action. You can visit them on the web at cspinet.org. Caitlin's joining us from the nation's capital.
Hi, Herb. Thanks for having me.
So, Bonnie, how would you describe the marketing often used to sell supplements?
Well, as you said, there are tens of thousands of supplements on the market today, and unfortunately, corresponding to that large amount, there are a lot of outrageous and misleading claims being made without any proof of efficacy about what these supplements can do. So we're seeing claims about preventing cancer, curing diabetes, regrowing hair, balancing hormones. I mean, there are even claims about treating made-up diseases like adrenal fatigue. It's pretty outrageous.
So they make up diseases to treat?
Correct. There are supplements being targeted to people for diseases that don't even exist.
Wow. Now, testimonials are often used to show the great results you can expect, right?
That's a very common marketing technique, and I think what consumers need to know about that is that just because there's a testimonial out there being used by the company does not mean that it's true, and that if the company couldn't say it, then they really shouldn't be saying it in a testimonial either.
Caitlin, for a recent Nutrition Action story, you said the industry uses, quote, sleight of hand to sell the vitamins, minerals, and herbs that most of us don't need. Tell us more about that.
Yeah, so as Bonnie was saying, supplement makers and their marketing teams are really brilliant at convincing us that our health will fall into disarray without popping a bunch of these supplement pills. And they take a lot of different approaches. So testimonials, as Bonnie just mentioned, is one approach. There's also something called advertorials, which are a combination of an advertisement and an editorial. You'll often see them in magazines. They can do sponsored content on health websites or by social media influencers. they run and pay for poorly designed clinical trials, really the possibilities are endless with what these companies will do.
And they're pretty good with wording. You call it linguistic loopholes. Explain how they use these linguistic loopholes to trick us.
Because of that law that was passed in 1994, supplement makers have a ton of leeway to market products as if they're beneficial to human health. There's some limits. They can't claim that their products prevent, treat, or cure a disease, but they can make what are called structure function claims, which say that the product supports or maintains some structure or function of the body. For example, you won't see a supplement that claims to relieve knee pain caused by arthritis. Instead, you'll see that it, quote unquote, supports joint health. And companies are also really good at just keeping things vague, but tapping into our psychology with allures to vitality, energy, or just being your best self. So they're not really saying anything, but it's inspiring, and that's all they need to say to stay out of the FDA's line of sight and to attract consumers.
And of course, people seeing these claims in the ads and on the bottle don't really know the distinction they're making. They say, oh, it's good for my knee. It's going to help me with my knee pain. These people know what they're writing and how people actually read it.
Exactly. Most people can't tell the difference between something that says it supports joint health versus will relieve knee pain. They read those the same way.
A really big problem is the questionable research that some companies use so they can claim their products are clinically tested or clinically proven. I know both of you are concerned about that. Bonnie, can you share your thoughts on this area?
Consumers are really motivated by seeing supplements that have some scientific backing. So when they see the magic words clinically tested or clinically proven, they're more likely to believe that the marketing on the supplement bottle or in social media platforms is true and accurate, even though it may be that the company doesn't really have the appropriate scientific backing to make those claims.
Caitlin, the stories you write for Nutrition Action often take a look at the quote-unquote proof that these things work, and some of them are really kind of silly if you really look at them the way you do.
Yeah, it's almost comical how bad the research on some of these is, but companies just want to say clinically proven because that helps them sell things. Just because something has been tested doesn't mean the science was well done. Companies fund these studies, but you have to ask yourself why they're funding them, and the answer will almost certainly be that so that they can sell more products. It's not about health, it's about marketing. So companies might fund a study that maybe doesn't have a placebo group, which makes the study useless, or they measure something that doesn't matter. They might skip the statistics altogether. Sometimes they publish it in a low-tier journal, which they pay for that article to be published, so that they can slap it on their website and say that their product was clinically tested. And look, we have the study to prove it. It just doesn't necessarily mean anything.
And sometimes they just give this stuff to their employees and say, hey, did it work for you?
Yeah, exactly. So that's what level of science we're talking about with words like clinically proven.
Let's talk a bit about supplements that promise to keep your brain sharp or help improve memory. You see the ads everywhere, and with an aging population, these supplements are really appealing. I know that both Tina and CSPI are very concerned about this. Bonnie, what is your take on all these brain claims?
Yeah, that's a great question. About 10% of U.S. adults age 65 and over have dementia, and the other 90% are worried about getting it. So we've seen statistics that about more than a quarter of Americans 50 and older are taking a supplement on a regular basis to boost brain health, according to a 2019 ARP study. Unfortunately, the marketing claims do not match the science, and a lot of older people are wasting their money with really expensive supplements that aren't going to help them stave off diseases like Alzheimer's or the like.
Caitlin, the ads are mighty impressive with all the testimonials showing how I'm a lot sharper and I can't believe the new me since I've started taking this stuff.
Yeah, most of the research on these supplements for brain health have come up empty despite these promising claims, despite the promising testimonials. There has been some research showing that some memory supplements contain unapproved drugs too, which is illegal. And so I'd say pass. A great example is ginkgo biloba. That one has been marketed for years and years that it supports memory. And some of the early studies showed a small effect of ginkgo. And then when larger studies not funded by the company, so funded by NIH, were conducted, they came up empty. But ginkgo can still be sold in supplements everywhere. So just keep these things in mind.
Dr. Swartzberg, I'd like to bring you back in. Is there any supplement we can take that has been proven to improve memory or delay the onset of cognitive decline?
That's easy to answer, Herb, and I can answer it in one word. No.
So all these products making these claims, they're just making claims that are not proven.
That's correct. They're not based upon any good science to confirm that they cause an improvement in your memory or reverse Alzheimer's disease or prevent any kind of dementia like Alzheimer's disease.
Okay, so having heard all this, you still think there may be some supplements that you want to take. How do you make sure you're getting what you paid for? That's next. I'm Herb Weisbaum, the Consumer Man, and this is Consumerpedia, powered by checkbook.org.
From tech gadgets to financial tips, travel hacks to health trends, Consumerpedia provides expert insights and practical advice to help you save time and money, avoid the scams, and stay healthy. With dozens of episodes to choose from, Consumerpedia is your guide to making informed decisions. Just go to consumerpedia.org and search by episode title or topic, such as home, travel, auto, finance, consumer protection, or technology. Checkbook's Consumerpedia podcast. Consumerpedia.org. Listen and learn, and share with your friends.
As we said at the start of this episode, some supplements, when recommended by your doctor, may be beneficial. I take vitamin D because my blood test showed I had low levels of vitamin D. But because there's so little government regulation of the supplement market, you need to be careful what you buy and where. Caitlin, are there quality assurance seals that we should look for?
Yeah, you'll see a lot out there, and most of them are meaningless, like third-party tested or GMP, which stands for Good Manufacturing Practice. Those aren't verified by anyone. But there are a couple reliable ones. You can look for a USP seal, which comes from the US Pharmacopoeia, or NSF, which comes from NSF International. If you see either of those, that means that a company paid one of those testing companies to test their supplement and that it contains what the label says. It's free of tested contaminants and that it disintegrates fast enough to get into your bloodstream. It just won't tell you whether it works or not.
And I think that's really important because, as we pointed out, these things aren't tested before they come to market. And there have been some horrendous cases of supplements being contaminated with stuff that could really hurt people. So if you're going to buy something, at least make sure it's been tested, right?
Yes, that's exactly right.
Doctor, can you explain why it's so important that if you take supplements, you talk to your doctor first and make sure the information is in your medical records?
Absolutely. Your doctor needs to know everything you're taking. That's why doctors keep a list of all the drugs that their patients are taking, because one drug can interact with another. But people often don't think that a supplement's a drug, and so they often don't tell their doctors about that. Actually, quite a few of the supplements that people take can interfere with the action of some of the drugs they're taking. They can make the drugs they're taking too potent, and therefore they could become toxic, or they could make the drugs that they're taking and very necessary for their health less potent. So make sure that your doctor knows exactly what you're taking and make sure that there's no interaction between the supplements that you're taking and the drugs that you need to take. Another person who can help you is not just your doctor, but your pharmacist can be a great resource. And make sure your pharmacist also knows, if he or she knows the list of drugs you're taking, make sure that the pharmacist knows about the drugs you may be also supplementing that you're buying over the counter that there wouldn't be any record of.
Two very popular supplements, ginkgo biloba and St. John's wort, can really have interactions with some medications, prescription medications that people take.
Yeah, St. John's wort, we know, interacts with statins, and a lot of people take statins. We know that St. John's wort can interfere with blood clotting for people who are taking certain blood clotting medications. It can interfere with HIV medications. It can interfere with some of your heart medications and oral contraceptives. So there's a whole long list with St. John's wort, and the same is very similar with ginkgo biloba, that ginkgo biloba interferes with a lot of medications that people take, so you have to be careful.
Final question for Bonnie and Caitlin. What can we do to clean up this Wild West marketplace? Maybe change the law, get Congress to do something. Maybe the Federal Trade Commission needs to crack down more. Let's start with you, Bonnie. What can we do to sort of protect people here a little bit more?
Well, we have talked a lot about the FDA and their lack thereof of protecting consumers from these supplements, but there are other state and federal agencies that can get involved to help. For example, the FTC, the Federal Trade Commission, can also go after supplement marketers that are making deceptive or misleading health claims. And also at the state level, your consumer protection bureaus or AGs can also go after rogue supplement manufacturers and marketers. So I think it's really important when consumers have issues to let their state and federal agencies know about it.
And Caitlin, what do you suggest?
Yeah, I would echo everything that Bonnie just said. I would love to see some movement at the federal level, but so far everything has been thwarted by Congress, and I think we have lobbying and trade groups to thank for that. So something for consumers to keep in mind is that we think of these supplements as natural, but this is a huge industry, and this is an industry that wants to make money just like any other industry. So getting some movement at the federal level, and if you have an adverse event, like Bonnie said, there's groups to contact and contact the FDA, and really support for groups like CSPI and TINA who are continuing to try to inform consumers about this.
You know, one of the ways they sell these products in some cases is to tell you, here's something the government doesn't want you to have.
Well, I think unfortunately that there are a lot of consumers out there that don't have trust for the medical establishment or pharmaceutical companies at this time. And, you know, some of it is rightly deserved from their own misdeeds and misleading marketing. And as a result of that, they're turning to other sources for their information and health advice. Unfortunately, a lot of those sources are trying to take advantage of these people to make money. So unfortunately, I guess what it boils down to is that supplement companies find it economically advantageous to lie to consumers about what these products can and cannot do. And it really is up to the consumer to do their research and try and protect themselves as best they can.
And John, as a public health educator, I know this really concerns you.
It concerns me on so many levels, and we've talked about much of that. But as a physician, when I see patients who are taking things, supplements, and they don't tell me about them, or they tell me about them after they've been taking them for a couple of years, I really worry. I worry about the interactions they can have that we discussed. But what I really worry about is also the fact that they may have a problem and they're taking a supplement in the hopes that it's going to help their problem, and they don't tell me as their doctor about it. So it's terribly important that good communication exists between their doctor and the patient.
Well, this has been a great discussion. I want to thank our guest, Dr. John Swartzberg of the UC Berkeley Wellness Letter, Bonnie Patton, the executive director and co-founder of TINA.org, Truth in Advertising. Find them on the web at TINA.org. They have a lot of articles where they look at specific supplements and what they think about the claims made. And Caitlin Dow, senior nutrition scientist at the nonprofit Center for Science in the Public Interest. We have just scratched the surface here, so I put a lot more information about supplements in the show notes. I hope you'll check it out. Thanks to all of you.
Thank you.
Thank you.
Thank you.
Well, that's it for this edition of Consumerpedia. We hope you'll rate this episode and follow us on Apple Podcasts, Spotify, or wherever you listen to your podcasts. Remember, we release new episodes every other Thursday. Another way you can support this show is to follow us on Consumerpedia on Facebook and Instagram, and at My Consumerpedia on Twitter. I'm Herb Weisbaum. Thanks for listening.
Consumerpedia is a public service of checkbook.org. We're a unique nonprofit that helps you save money and make smarter choices. You can count on Checkbook to help you find the best services and avoid the worst, with local ratings that are accurate and unbiased. If you live in or around these 7 cities and haven't joined Checkbook yet, check us out. Boston, Chicago, Philadelphia, Seattle, San Francisco, Minneapolis-St. Paul, and Washington, D.C. To get your free 30-day subscription, go to checkbook.org/consumerpedia. If you like what you've heard, we hope you'll become a supporter by using the link at the bottom of the show notes to make a small contribution each month. Consumerpedia, empowering consumers to save money and make smarter choices.